What if I told you that the Medicare plan you're considering right now could leave you bankrupt when you need care the most? Have you ever wondered why insurance companies are spending billions advertising those zero-premium Medicare Advantage plans with all those incredible extra benefits? Before you sign that enrollment form, I need to share something urgent with you. My own mother thought she was making the smart choice with her Medicare Advantage plan, until she needed emergency surgery while visiting my sister out of state. What happened next devastated our family financially. And the worst part, it could have been avoided. Did you know that in 2024, a shocking 54% of all Medicare beneficiaries are now enrolled in Medicare Advantage plans? That's nearly 31 million seniors, many of whom have no idea about the pitfalls I'm about to reveal. Stay until the end of this video, because I'm going to show you exactly how to evaluate whether Medicare Advantage is right for you or a dangerous trap that could compromise your care when you need it most. In the last 5 minutes, I'll share a decision-making framework that none of the insurance brokers want you to know about. Welcome back to Gray and Wised if you are an old subscriber, and if you haven't subscribed, kindly hit the subscribe button. Today, we will be sharing 25 years worth of retirement research that has helped seniors from all walks of life enjoy a financially prosperous retirement. Today, we're diving deep into Medicare Advantage in 2025, a topic that's more critical than ever as these plans undergo significant changes. Let me be clear. I am not a licensed insurance agent or healthcare professional. What I'm sharing today comes from extensive research, interviews with hundreds of seniors, and my own family's experiences. Always consult with a licensed professional before making your final decision. But what I can promise you is this: by the end of these 30 minutes, you'll understand the hidden restrictions in Medicare Advantage plans that insurance companies don't advertise, why traditional Medicare might be worth the extra cost for many seniors, the 3 critical questions you must ask before enrolling in any plan, and a step-by-step method to determine which option truly protects your health and your finances. Let's get some context. Medicare Advantage enrollment has skyrocketed from just 13% of Medicare beneficiaries in 2004 to an astounding 54% in 2024. That's not by accident. Insurance giants like UnitedHealthcare, Humana, and Aetna have poured billions into marketing these plans. In 2023 alone, Medicare Advantage advertising topped $4.5 billion. Ask yourself, why would for-profit companies spend that much unless they were making even more? The industry doesn't want you to know this, but Medicare Advantage plans operate on a fundamentally different model than traditional Medicare. While traditional Medicare pays doctors and hospitals directly for the services you receive, Medicare Advantage plans receive a fixed payment from the government for your care, regardless of how much or how little care you actually get. Think about that for a moment. The less care you receive, the more profit these insurance companies make. In traditional Medicare, the government pays approximately $14,000 per year per senior. With Medicare Advantage, the government pays private insurance companies roughly the same amount. But then the insurance company becomes the gatekeeper for all your care. Meet Eleanor, a 72-year-old retired teacher from Ohio. Eleanor joined a Medicare Advantage plan in 2022, attracted by the zero premium and extra benefits like dental coverage and a gym membership. For the first year, she was thrilled, saving over $2,400 compared to what she would have paid for traditional Medicare plus a supplement. But then Eleanor was diagnosed with an aggressive form of lymphoma. Suddenly, Eleanor's world changed. Her oncologist recommended a specialist at a major cancer center 2 hours away. But her Medicare Advantage plan denied the referral, insisting she use in-network providers only. When she appealed, the process dragged on for weeks while her condition worsened. Eventually, Eleanor paid out of pocket for the consultation, $3,500 she couldn't really afford. The recommended treatment would cost tens of thousands more outside her network. Eleanor faced an impossible choice: delay potentially life-saving treatment while fighting the insurance company, drain her retirement savings, or settle for the in-network options her doctors felt were suboptimal. What Eleanor did next completely transformed her situation. I'll share her full story and critical decision later in this video, and how her approach can help you avoid the same nightmare. Here's where things get confusing for most seniors. You've probably heard all these amazing things about Medicare Advantage. 0 monthly premiums. Prescription drug coverage included, dental, vision, and hearing benefits, gym memberships and wellness programs, transportation to medical appointments, even meal delivery and over-the-counter allowances. And yet, patient satisfaction surveys consistently show that people with traditional Medicare report higher satisfaction with their coverage than those with Medicare Advantage. How can something that offers more benefits actually deliver less satisfaction? According to the Medicare Current Beneficiary Survey, 71% of traditional Medicare beneficiaries rated their coverage as excellent, compared to just 65% of Medicare Advantage enrollees. More troublingly, when it comes to accessing specialist care, the gap widens significantly. 78% satisfaction with traditional Medicare versus 58% with Medicare Advantage. The disconnect comes down to something most seniors don't realize until it's too late. Medicare Advantage plans have powerful tools to restrict your care that traditional Medicare doesn't. Network restrictions. You're limited to doctors and hospitals in your plan's network, which can change annually. Prior authorization requirements. Your doctor's recommendations must be approved by the insurance company before you can receive care. Step therapy protocols, forcing you to try less expensive treatments first, even if your doctor recommends something else. High out-of-pocket maximums. While capped, these can still reach $8,300 per individual in 2025. Ask yourself, what good is saving $2,000 a year if you can't see the specialist you need when cancer strikes? What value are those extra benefits if you're fighting authorization denials while your health deteriorates? Now, I want you to imagine yourself in this situation. You're 74 years old and have just been diagnosed with a serious heart condition. Your cardiologist believes you need a specific procedure, but your Medicare Advantage plan has denied it as not medically necessary. You face two painful options. Asterisk option 1. Fight the insurance company through appeals that could take months while your condition potentially worsens. Statistics showed that 75% of Medicare Advantage denials are overturned on appeal, but only 1% of seniors actually complete the appeal process. Option 2. Pay out of pocket for the $40,000 procedure, potentially draining the savings you and your spouse need to live on for years to come. What would you choose? Your health or your financial security? Now let me tell you what happened to Harold, a 77-year-old former client of mine. Harold chose to fight. For 3 months, he battled through the appeals process, gathering additional documentation, getting second opinions, and enduring mounting stress while his symptoms worsened. Eventually, Harold won his appeal. The procedure was approved and performed. But here's the unexpected consequence. The delay allowed Harold's condition to deteriorate. What should have been a routine procedure became complicated. Harold spent 11 days in the hospital instead of the expected 3. He developed an infection that required additional treatment. And because he had chosen a Medicare Advantage plan with an $8,000 out-of-pocket maximum, Harold still ended up paying thousands more than he would have under traditional Medicare with a good supplement. The cruel irony? Harold had chosen Medicare Advantage to save money. Let's get specific about the financial realities of both options, so you can make an informed decision based on your personal situation. Traditional Medicare in 2025. Part A. $0 premium for most people. Part B. $179/month projected for 2025. Part D. Approximately $40 to $100/month. Medigap Plan G. $150 to $350/month. varies by location and age. Total monthly cost, $369 to $629. Annual cost, $4,428 to $7,548. Out-of-pocket maximum, effectively unlimited without Medigap. With Medigap Plan G, only Part B deductible, $240 in 2025, plus Part D costs. Medicare Advantage in 2025, monthly premium, $0 $150, many plans at $0. Part B premium still required, $179/month. Total monthly cost, $179,329. Annual cost, $2,148, $3,948. Out-of-pocket maximum, up to $8,300 for individual plans. On the surface, Medicare Advantage could save you $2,280, $3,600 per year. That's significant money for many seniors on fixed incomes. But here's what the insurance companies don't emphasize. That savings is essentially you betting against yourself needing serious medical care. According to health utilization data, the average 75-year-old has a 20% chance of hospitalization each year, 35% chance of needing expensive specialty care, 85% probability of requiring at least one prescription medication. For a senior who faces one hospital stay and 2 specialty care situations, the actual out-of-pocket costs tell a different story. Traditional Medicare with Medigap Plan G. Annual premiums, $4,428 to $7,548. Out-of-pocket for hospital stay, $0. Out-of-pocket for specialty care, $0. Prescription costs vary by Plan D choice. Total annual cost, approximately $4,428 to $7,548 plus Part D costs. Medicare Advantage. Annual premiums, $2,148 to $3,948. Out-of-pocket for hospital stay, $1,500 to $3,000. Out-of-pocket for specialty care, $1,000 to $2,000. Prescription costs typically lower. Total annual cost, potentially up to $8,300, the out-of-pocket maximum. Before making your Medicare decision for 2025, you must ask yourself these 3 critical questions. Question 1. How important is provider choice to you? With traditional Medicare, you can see any doctor or hospital in the country that accepts Medicare, approximately 93% of all providers. With Medicare Advantage, you're restricted to network providers, which typically include just 60 to 85% of providers in your area and almost none outside your service area. If you travel frequently, live in multiple locations throughout the year, have established relationships with specific doctors, have complex conditions requiring specialists, then traditional Medicare offers significant advantages. Question 2. What's your health status and family history? Be brutally honest with yourself. Do you have chronic conditions like diabetes, heart disease, or cancer? A family history of serious illnesses? Multiple medications? A history of hospitalizations? If you answered yes to any of these, the restrictions of Medicare Advantage could become problematic exactly when you need care most. Question 3. Can you afford the worst-case scenario? With Medicare Advantage, you need to be prepared for the possibility of hitting that $8,300 out-of-pocket maximum. If that would create financial hardship, the predictable costs of traditional Medicare with a supplement might actually provide more financial security despite the higher monthly premiums. Now, as promised, here's the framework that insurance brokers don't share, because it helps you make the best decision rather than earning them the highest commission. Step 1. Calculate your risk tolerance number. Start with 100 points. Subtract 20 if you have any chronic conditions. Subtract 10 for each specialist you see regularly. Subtract 15 if you travel frequently. Subtract 25 if paying $8,300 in 1 year would cause significant financial strain. Add 10 if you're in excellent health with no family history of serious illness. Add 15 if you live in an area with excellent healthcare systems that all participate in local Medicare Advantage networks. Step 2. Interpret your score. 0 to 40. Traditional Medicare with a comprehensive supplement is likely your safest option. 41 to 70. Moderate risk zone. Could consider either option based on specific plan details. 71 to 100. Good candidate for Medicare Advantage if the specific plan meets your needs. Step 3. Plan-specific evaluation. For any Medicare Advantage plan you're considering, request the complete provider directory and verify your doctors are included. Ask for the prior authorization list, which procedures require insurance approval. Review the summary of benefits for specific copays related to services you're likely to need. Check the plan's star rating. Avoid anything below 4 stars. Research the plan's denial rate for claims and prior authorizations. Remember Eleanor from earlier? She ultimately switched back to traditional Medicare during the next enrollment period and purchased a Medigap Plan G, despite the higher monthly cost. When her cancer returned a year later, she had complete freedom to see any specialist in the country without authorization requirements. Her out-of-pocket costs were minimal, and she could focus entirely on her treatment rather than fighting insurance battles. Today, Eleanor is in remission and advocates for other seniors to carefully evaluate their Medicare options. The Medicare decision is one of the most important healthcare choices you'll make. Don't let flashy advertising or short-term savings blind you to the potential long-term consequences. Remember, insurance companies profit when you don't use services. The government pays them the same amount whether you receive extensive care or none at all. If you found this information valuable, please hit that subscribe button and share this video with other seniors facing this decision. Medicare's annual enrollment period runs from October 15th to December 7th, so time is limited to make your choice for 2025. In our next video, I'll be diving into the specific Medicare supplement plans and which offer the best value in 2025. Click the notification bell so you don't miss it. Until then, this is Gray and Wise, helping you protect your health and your wealth in retirement. Disclaimer. This video contains general information and personal opinions based on research. It is not professional advice. Always consult with a licensed healthcare provider, financial advisor, or insurance professional before making Medicare decisions.